konuşmamın başında da söyledim.
As I said at the beginning of my speech, we've had a problem with Turkish Airlines. She couldn't do the check-in because she waited to do it at the airport, but then, his ticket was sold to someone else, so he's apologizing to you. So he sent this slide so that we can have a look at it together. Now we know that everyone is more knowledgeable about the law, and with the recent changes in law, complications that could be seen because of ECT and its repercussions are a cause for a lawsuit. So we are under a bigger risk now. ECT is a very efficient treatment method. We know that. Our colleagues have also mentioned the same. In the past, we used to see a lot of catatonic schizophrenic patients, but nowadays we don't come across them. Maybe we start the treatment at earlier phases and we don't have many patients that are not treated. But for catatonic schizophrenia, ECT is and used to be the most important treatment method, especially for those patients at high suicidal risk or living alone, and also for pregnant patients. As my colleagues before me have said, ECT was the most efficient and also most reasonable in terms of cost. Side effects and complications were lower. Therefore, this used to be a treatment method that we could not give up. But also, we have these recent legal changes and some implementations that made ECT a justification for malpractice, and now we are under risk of being sued for that. Here we have some concepts regarding the law. It's, for example, one of them is neglect. The physician is responsible for treating and taking care of the patient. The physician can have an unnecessary initiative for such a case, and both of these cases are called neglect. Let's give an example from the United States. Malpractice, one of the most reverted reasons for malpractice, and we see at the 9th item, we see that at a rate of 4%, that means 4% of malpractices are related to ECT. Here also we see that regarding malpractice and related ECT, we see that bone fracture risk and some neglect regarding the procedure. Starting the ECT prior to previous radiological analysis, complaints from the patient are not taken into account regarding the pain or disturbances. Also, the measures or insufficient measures related to prevent the patient from falling could be the causes for lawsuits. What do we need to have in order to see malpractice? First of all, there should be a relationship between the patient and the responsible physician. There should be a deviation from standard treatment. And the patient needs to have been affected, harmed by this deviation, and this harm should be the direct cause of this deviation from standard treatment. There's always a filer in malpractice cases, a person who's filing the lawsuit. Sometimes malpractice could be happening, but there could be a neglect on behalf of the patient in terms of filing lawsuits. We don't have a high rate of lawsuits in our country, but nowadays we have more lawyers, and lawyers are looking into these cases more and more. Sometimes they're also misguiding the patients, even with little side effects. some law offices have tendencies to open up lawsuits, even in cases of little side effects. What could be the subject of malpractice in terms of ECT? Indication that is based on scientific basis, lack of indications, misinformation to the patient's families or relatives, lack of ECT under anesthesia or muscle relaxation. We need to make use of anesthesia for ECT. In the past, we used to do it without ECT, and we did not have any complications. We used to do 7 or 8 ECTs per day, and we didn't have any problems. Only the jaw used to fall off, but we used to fix it very quickly. It wasn't a big problem. Sometimes fractures happened. If there's osteoporosis, it was normal to have bone fractures, but we used to be able to treat these. We were doing it very often. But in the past, we did not have the medications we have today, like antipsychotics, Neurodol. We didn't have Globixol either. We had Stelazan or Telazin. We used to have some antipsychotics and antidepressants. Now we have more medication. So the usage of ECT is less needed. But in the past we used to revert to ECT more often, every time that we needed it. Lack of treatment could be a reason for malpractice, or sometimes over-treatment could be a cause for a malpractice. Lack of proper records, record keeping, oxygen saturation, duration. In hospitals, we use this Traton system 4. We have now a proper recording system, but we always have to take notes. Sometimes it's difficult to protect and register everything properly, and lack of this recording could be a cause for malpractice as well. From the ethical perspective, when we look at ECT, we see that there are different opinions. Some of these opinions do not perceive ECT positively at all. During the Second World War, Hitler's soldiers or army used to utilize these methods, and because of these utilizations, ECT is perceived very negatively. But this is a problem that happened in history. We need to focus on scientific truth. This is our job. Complications regarding the ECT, like memory loss or similar problems, fractures, vomiting problems, related side effects could be observed, but ECT is definitely an efficient treatment method, and when it's applied properly in the proper area, it should be opted for. Negative opinions about the ECT are listed as follows. If we could not get a result from other treatment methods, we can opt for ECT. ECT is efficient and life-saving. The patient does not feel any pain, and it shortens the treatment period because the patient does not feel pain even if we don't use anesthesia. If it's not infra, if there is convulsive seizure, the patient does not feel pain. They will remember that they were entering a room because there's amnesia in that sense. But if we administer electricity at levels which will not cause convulsive seizures, and if there's epilepsy threshold which is higher, in that period, patients would feel pain. But before waking up, if you increase the dose, then the patient will have forgotten this pain. So about implementation of ECT, the Association of Turkish Psychiatry has some rules. I will not read these items one by one because we don't have enough time. If you're interested, you can take these slides because the professor gave me this authority. I can share this slide with you. When we apply ECT, being ethical is important. Psychotic depression, catatonia, severe manic seizures, suicidal risk, catatonic aggressivity. That means these are situations with high possibility of being beneficial. If the physician believes that this will be beneficial for the patient, he or she should use ECT. The ECT should not be the counterindication. In ECT with anesthesia, intracranial lesions or aneurysms are excluded from this. We should properly inform the patient regarding the ECT. Most of these patients who will receive ECT will not be in a position to make a decision for themselves. We cannot explain this to catatonic schizophrenic patients. If this patient is not talking at all or highly depressive, how can you get a signature, a consent? We have to inform his relatives or family. So we should explain that this is an indispensable treatment for this patient. Mostly in our daily practice, we see that patient relatives are against it as well. Probably they see things on the internet or on some websites. They get improper information, and with this, based on that, they refuse to apply ECT for their patients. When we do ECT, we need to pay attention to these following items. Again, in the US, there's a legal framework requiring ECT. At least 2 experts should provide a consent for application of ECT. If there's no approval, then the courts can make a decision on behalf of this patient. Before ECT, lab analysis and consultations have to be done properly. Also, muscle relaxation. Utilization of muscle relaxation should not be an obstacle before the application of ECT. Registries have to be kept, records have to be kept for ECT applications, and anesthesia should be administered. This is the application in the UK. The patients are informed, they approve the use of ECT, and the following methodology is followed. If the patient is capable of understanding, then they are convinced and they are informed. But then if that's not the case, the patient relatives are consulted with. There is a health commission together with the patient relatives to approve the use of ECT. Psychiatric Health Commission should define the situations under which the ECT will be applied. If the patient is under the risk of harming himself or the relatives, then in that case, also for adolescents and children, we need to have the consent of an expert. International treaties are also important. This is the European Court of Human Rights decision, and as well as the Athens Declaration of the International Psychiatry Association. These are necessary. Also, the Vienna Declaration. These all indicate the possibility of applying ECT. Professor Ibrahim has also shown the situation in our country. We summarized the legal situation. We need the consent of the patient, but if that doesn't exist, or if the patient is in no condition to proper consent, then either the parent or the relatives for minor patients or patients older than 18 years old should provide a consent. Also, the court might give the consent for obligatory admissions, then we can apply ECT. Here you see the necessary, the related articles in our law. Because we don't have enough time, I'm not going to read all of these. But he also gave information about malpractice. In order not to be under the risk of malpractice, we need to write down all the justification, item by item. We need to have yes and no answers for all of these items. Bakırköy Hospital has a methodology that they published that we should pursue. I think most of the hospitals in Turkey are using the same methodology. We are also going to use it. So for this, we have to keep the documents in place, we have to record everything, and we need to define the indications properly. And if that's not the case, then we need decisions by the court or by the commission. So if you get the approval, then you won't get into trouble. But of course, notwithstanding all these measures, all treatments include some risk of complications. Therefore, during my military service period, I was in Gülhane Hospital, and during my term, in the first years, we used to do a lot of ECTs because there was a high amount of patient circulation. We needed to minimize the treatment period, and it was an efficient method in those circumstances. I don't know whether there were malpractice cases. Maybe, but you are in a position to evaluate the situation for yourself, and you need to establish good dialogue with patient relatives. Memory problems are the most often observed complications. Sometimes it's also extended, but in general it's 3 to 6 months that this comes back. And the other side effects could be handled with our colleagues in relative departments. ECT, I think, should be the primary treatment that we should opt for. Catatonia, schizophrenia, manic excitation that cannot be controlled by medication, or major depression with high suicidal risk, also schizophrenic patients that cannot be controlled with medication. Under those cases, we should use ECT. There is a debate about that. There are some colleagues who claim that ECT does not have a place in treatment of schizophrenia, but if we cannot control the situation with medication after a certain period, I believe ECT can be used. Thank you for your presentation and participation, especially those speakers I want to extend my gratitude to. Our professors could not be here, and I'd like to congratulate all of you for these presentations. Do you have any questions? You can ask your questions now to myself or to my colleagues.